You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today, our guest is Dr. Cromley. Thank you for coming back again.
Sure.
I guess the first time wasn't so bad, so you're back.
Yep.
And the topic today is a whole mouthful of words: osteopathic manipulative medicine. I had to look it up, I'll be honest. But it's very interesting. You recently did a luncheon program for us, and it was a really interesting topic. So I just kind of wanted to cover it on the show. So tell me a little bit about what it is, how you got it. Is it part of the DO, because you're a DO physician, how all that works?
Yep. So I guess to best explain it, I'll give you my backstory. So there are two medical schools that you can go to in the U.S. One you graduate from, you get the MD designation, and the other one you get a DO designation. It doesn't change what you can go into. You can go into neurosurgery, plastic surgery, cardiology if you go to either school. The main difference between the two schools is that one, the DO school, you learn manipulation. So for me, I chose to go into manipulation, straight from the get-go, where some people don't always know for sure that they want to go to a DO school. It all happened when I was in high school. My sister was in a baseball accident or a softball accident. She was a catcher at home plate and got ran over by somebody. And after that happened, she had some headaches and back pain, and she just wasn't very comfortable for a couple of weeks, and lots of medicines and pain medicines and things like that, and she just wasn't getting better. A friend of the family happened to go to our church, was a DO, came over and did what's, I now know as manipulation on her, and she was pain-free, headache-free, and felt fantastic.
Wow.
So I thought, I want to learn that.
That's a pretty cool story.
Yeah.
So what happens after that? You went to, like you said, it's medical school, just like...
Yep. Yeah, so in order to get into medical school, you have to have a bunch of classes from undergraduate. I went the long way. I didn't do my undergraduate degree in biology or chemistry or anything like that. I actually worked in business for a couple of years and then went back to school and took my prerequisite classes. Went to medical school in Tennessee, and spent a little bit of extra time learning about manipulation over and above what we actually have to do. Okay. The basic curriculum includes, I want to say it's 2 hours a week of lecture and 4 hours a week of lab work, where you're actually learning the hands-on skills during the first 2 years, and then they continually add to that during the third and fourth years of medical school, and then the 3 years of residency.
Okay.
Yeah.
And I know some people, as I was reading up on this, they would kind of compare it to chiropractic care.
Yep.
And I suppose there's similarities and differences. Can you talk about those a little bit?
Sure. So actually chiropractic medicine got its start from osteopathic medicine back in the late 1800s. There was the guy who started chiropractic medicine was a DO at one time, and for whatever reason he got booted. And they said they couldn't be a physician anymore, but he could continue to teach the manipulation aspect of it. So some of our techniques are the same, some of the principles are similar, but when everybody thinks of a chiropractor, they generally think of somebody who does a lot of neck cracking and back popping and a lot of big movements that patients tend to describe as rough. While I'm capable of doing those things, the extra training that I got allows me to do that work with a lot less abruptness.
Okay.
My patients, actually just had a guy just last night, his wife came back to his follow-up appointment, and he said that when he went home after his first appointment, he was joking with her that it felt like he wasn't doing anything. and then I got up and I felt better.
That's perfect.
Yeah, exactly.
Everything should be that way. It's magic. Okay, so some similarities, some differences.
Yep.
Okay.
Yeah, and just to be clear, a chiropractor, the limit of their scope of practice is doing manipulation only. Some people come to me and tell me that they've been recommended to do certain things, take certain things, and a chiropractor doesn't really have that sort of scope. The benefit of coming to me is for all your neck pain, back pain, all that kind of stuff that you go to a chiropractor for, I can do that and take care of your hypertension, diabetes.
Other stuff like that.
Yeah.
Gotcha. Okay. Now, I know a person can come see you or another DO who does manipulation and not have to change doctors. They can stay with their primary care physician.
Yeah. Yep. Yeah. So while a lot of physicians have been taught the manipulation, most DOs actually don't use manipulation much. So, if you go to a DO that doesn't use manipulation, you can come to me for manipulation. Yep, I have probably a dozen or two patients that just come to me for manipulation and still continue to go to their primary care doctor, and that's more than fine with me because I'd rather do more manipulation.
Right.
Yeah.
And if they have a good standing relationship with their family doc, there's no need to change. This is just another tool for them to.
Yep.
So they can stay with their family doc, their specialists, all that kind of stuff. That doesn't change.
Yep. The most common situation for that is, a lot of women prefer to have a female doctor for the women issues, so they continue to go to their practitioner that way, and then come to me for manipulation.
Okay.
Yep.
Very cool. Do you find that it's ongoing, or do they come, once or twice or I know what your answer is going to be. It depends, right?
Yeah, it depends. Yeah, so I have some patients that I've seen on a regular basis, and I have some patients that I see once or twice and I never see them again. It depends on the etiology of what you're seeing me for. So some people who have a chronic pain issue, or they have bad posture that they're trying to work out, and in the meantime, they're having neck pain or back pain. I'll see them every 3 or 4 weeks. But the regular person that you think of after a car accident or something like that has back pain, I'll see them 2-3 times, maybe 4, and then usually they're better. But I probably have a handful of patients that I saw at my last practice where I saw them literally every month or 6 weeks.
Okay.
Yeah, and it was sort of on them. I never prescribed, okay, you have to come back every couple of days. And that's another big difference between chiropractors and DOs. I believe that if I'm doing my job, I don't have to see you every week.
Sure.
My patients sometimes complain that when they go to another practitioner, they might have to be seen 3 times a week for the next 6 weeks or something like that, and that can get pretty expensive.
Sure.
Whereas coming to me, usually I don't see people more than every week or 2 when it's an acute phase and your insurance pays for it.
Gotcha. So it depends.
Yeah.
Which I think is kind of one of the things, again, in reading up on this, one of the things that kept recurring in the literature was it depends. Just because manipulation did or didn't work for your neighbor for their back pain or for their whatever.
Right.
I guess talk about how you determine if it's something that somebody needs. You spend some time with them figuring that out.
Yeah. So to joke, it truly does depend on what the etiology is. The vast majority of the patients that I see in my practice come for back pain, even though I can do a lot more than treat back pain. But I spend a fair amount of time during the first appointment, 10 or 15 minutes, just describing or sort of educating the patient on the etiology of their back pain and why they don't need narcotic medication or why they don't need x-rays or MRIs right away in most cases. And then after that, the plan of care just determined by what I find to be the problem. Quite often the problem is just a muscle imbalance, which causes some fatigue in a different area, and that fatigue causes spasm, and that spasm is what I address initially, but then long-term addressing the other area that's weak or not being used ultimately leads to long-term success.
So that's the importance of coming in and going through that history and physical and all that kind of information to figure out. And again, just because, well, I was referred to you because my neighbor said, their shoulder pain was fixed or whatever, your shoulder pain might be a different cause. You might have a different reason.
Absolutely. And that's the kind of the fun part of my job is a lot of patients come to me believing that their problem is this one thing, and when I turn around and fix something else and their pain goes away, they think, I guess I was wrong. I have patients that come to me all the time with knee pain or hip pain, come to find out it's actually their back. And I don't even touch their knee, I treat their back and their knee pain goes away.
Gotcha. It is magic.
The chair of my program at my school, he actually used to joke that it was magic. And I went to him a few times for treatment on my back, and it literally felt like magic. I mean, the guy barely touches you, and it goes away. Yeah, I'm not quite as good, but working towards it.
We're getting on. All right. All right, we're going to take a quick break, and we're going to be right back talking more about osteopathic manipulative medicine. Talking about, I'm going to call it OMM from now on.
That's perfect.
All right. So we talked about the training of it, and that a person can stay with their family physician but still come to see you or somebody who does manipulation, and the ongoingness of it just kind of depends on the cause. And a lot of things that we've talked about so far are sort of musculoskeletal, back pain, knee pain, that kind of stuff. Is it all primarily just for that, or is that how a lot of other issues in our body manifest?
It depends. No, with all seriousness, yes. So when most people think about osteopathic manipulative medicine, they think about the musculoskeletal system. And the vast majority of physicians who utilize OMM stick with the musculoskeletal system. People who get additional training learn that you can actually manipulate different areas of the body.
Okay.
So if my hands can touch it, you can manipulate it.
Okay.
A good example is one of my patients that I saw on a fairly regular basis at my last job had post-surgical adhesions, and the short story is I was on rotation with a gynecologist, and this girl had been coming to her for 18 months. And over that 18 months, she'd had some polycystic disease and some pain there. One of the cysts had ruptured, and they thought that was the problem. The pain didn't go away. They actually had they opened her up to explore to see what else might be the problem, and couldn't find anything else except for adhesions after that had happened. So with every monthly cycle, she got excruciating abdominal pain. So they changed her birth control, they checked her hormones, they just couldn't figure out what it was going on. And fast forward 18 months to where I'm there for this encounter. And the gynecologist that I'm with is a spectacular gynecologist. I mean, she's one of the teaching faculty for the Cleveland Clinic OB-GYN residents, so she knows what she's doing.
Right.
But she looked at me and she was like, I just don't know what to do with this girl. And the patient looked in obvious pain. She looked real haggard, she looked tired, she looked just overwhelmed. She's a 25-year-old person that her mom had to bring her to her doctor's appointment. So imagine what it would take for you at 25 to have your mom bring you to your appointment. So I asked if I could just see if one thing could work. And I treated what I felt was post-surgical scarring, and you can actually feel the tension inside the abdomen. And I honestly didn't have a lot of experience in it. I just learned the theory of it and just did the basics. And in a minute, the girl said that her pain was 50% better.
Wow.
And I was just as surprised as she was. So I spent a little bit of extra time learning from one of the teaching faculty about what I could do for this patient, and then she ended up following with me for about every month.
Okay.
Yeah, and if she didn't come to me before her menstrual cycle, she would have excruciating pain.
Horrible pain.
And that the one time that she did miss her appointment because of work, she actually ended up going to the ER because she was in pain so bad. And ever since I started treating her, she didn't, except for that one time, she didn't take any more pain medicine.
Wow, that's
She didn't have any other imaging. She didn't have anything else wrong.
Wow.
Yeah.
I read in one of the things I was reading, they talked about, it happened to be a young woman in this story also, and she had gone to her doctor and basically was diagnosed with like abdominal pain and irritable bowel syndrome, and had gone through all that. So it was, gut pain. It wasn't knee pain or back pain, but finally got hooked up with a DO who did manipulation, and it was like, I'm not going to say this right, but it was the muscles in the joints around all her guts were not working right, and once that was adjusted or manipulated, her gastrointestinal, so it's not necessarily just back pain, knee pain.
Right. So to clarify, I can't feel the individual loops of small bowel and move them around.
Right.
But your small intestines is 20 feet just wrapped in around itself. And if it gets twisted so far in one direction, it can, cause problems. So generally, the principles is just, you just try to help the body do what it wants to do to get things back in place. Sometimes you can, sometimes you can't.
And that was the other thing that was in that, was that the body's pretty darn amazing. It wants to work, and it tries real hard to work normally, and sometimes you just need to shift things around to get it to work right.
Yep. That's probably the most important thing that I talked about with every single one of my patients is, when people come to me with really bad pain in their shoulders or really bad pain in their back, it's been bothering them for so long, they absolutely are convinced that they have a disc that's out, or they have this or that. And when I tell them that it's because they have bad posture or weak abdominals or they're doing something wrong, most patients look at me with incredulity and think, this guy doesn't know what he's talking about. And then we make some progress, and they do some of the exercises that I prescribe, and they come back and say, you knew what you're talking about.
Touche.
And that to me is the part that is most gratifying, because when you can give somebody their life back without pain or with less pain, that's pretty great.
That's pretty awesome.
And it doesn't matter if you're 100 pounds or 500 pounds, your back pain can go away.
All right. So another thing I was reading, that because of it's hands-on, and so people might not be used to that, or there might be different comfort levels with that.
Yep.
So talk about I read some fancy words, palpation and things like that.
Yep. So generally, obviously, when you put your hands on somebody, it's a different level. I don't know about you, but there's been several doctors in my life that never touched me at all. They got real close, but a stethoscope was as close as they got.
Yeah.
So yes, there is a little bit of a different level of care that you get, but the majority of the treatments that I give are pretty cursory. So this area tends to be a lot of what I treat, and then the low back is a lot of it as well. But if patients have any questions about what I'm doing and why I'm doing it, I tend to talk through what I'm doing and what I'm feeling, just to sort of educate along the way.
Right. I mean, I would liken it to going to a massage for the first time. If somebody's never had a massage and they go to a massage, they might be like, you want me to what?
Yeah. Yep.
So same thing, that you kind of talk through it with them and explain what you're doing. And
Yep. Yeah, so I usually have somebody, I have a table, so we'll say, well, this is a table. I have the patient sit down, and I sit down right next to them, and as I'm doing their exam, I'm explaining what I'm feeling. And then I have them lay down, and I say, lay down and put your head about there, so I can have enough room to lean on the table to work around your head. And depending on what else they're here for, I do an exam while they're laying down as well. And, you know, I tell them, oh, your hip flexor is tight, that's why you're having the pain here, or, you know, your shoulder is tight, your shoulder's protracted.
Gotcha.
Yeah.
That just brought up a thought that I heard somebody say the other day, that all the cars that have the cameras in the back, so people aren't turning and twisting as much to look, that actually is causing some issues because people are not twisting and turning as much. Do you think that's for real?
I don't know if that is for real, but I can say with a fair amount of certainty that the lack of people's motion in general is the problem for a lot of people. If you do just this all day long, if you're just sitting down all day long and you sit like this, that is a bigger problem. Yeah. There's nothing wrong with doing other motions that some people tend to avoid because it causes pain. It's not the fact that they're doing the motion that causes pain, it's the fact that they're doing it incorrectly. Just a good example is, I have a patient who, for years, she said that she had a hard time turning her head to look behind her to look at the traffic or something like that. But her shoulders were like this. As soon as I had her bring her shoulders back and turn her head, she had no pain.
No problem.
And seeing that look on her face, she was like, wow, for 10 years I thought I was just getting old and had arthritis in my neck, and now I don't.
So all those years when your mother was saying, sit straight, watch your posture, she knew what she was talking about.
Your mom knows what she's talking about.
So in the talk you did for us at the luncheon, you talked about, you know, so many things can be fixed by really pretty simple, just the movement, posture, walking, drinking water. And you also talk about stress. How is a lot of this related to stress?
Some of the patients that I see, sometimes chronically, have anxiety and or stress that they have a difficult time managing, and they just are bound up. And that tension they carry in their shoulders, or you know, in their low back, or because they're worried about back pain, they hold themselves stiff and straight like this. And once we get past that barrier, either address the anxiety or stress, or help the patient just deal with that stress a little bit better, then they find that their muscles tend to relax a little bit. So some people that continue to struggle with that, you know, they tend to come to me, you know, for a long time.
Right, because stress keeps coming at us.
Yeah, exactly. But it's, you know, why not? It's at least worth giving it a shot, because a lot of the patients that I've seen just since I've been in town have come off medicines. I've had several patients who have been on narcotic pain medications, pretty big doses, for the last couple of years.
Right.
And they came to me, and I figured out that, you know, a good source of their pain is not a pain, it's actually a pain. And, you know, after 1 or 2 treatments and putting them on the right medicine, they actually come off their narcotics.
Gotcha.
Yeah.
That's pretty huge.
Oh, it's very gratifying.
And again, it's kind of just another, you know, very important tool. You know, maybe massage, maybe, you know, it's certainly in some situations, and I guess I should say this too as kind of a caveat, is sometimes you need to be on pain medication, or you need to be on, you know what I mean? This isn't the, you know, fix it for everything.
Sure.
You know, in the article I was reading, there are some people who have abdominal pain, and it is irritable bowel syndrome. Everything is lined and everything's fine, there's just something wrong. So there are, you know, it's not that everything is related to that, but.
Yeah, one thing that people, before I started doing manipulation, I used to hear that people would joke that, you know, their chiropractor used to say that they could treat anything with manipulation. I can't treat everything with manipulation, but I can treat a lot of things with manipulation.
And a lot of things people might not think of, like
Right.
abdominal pain.
Yeah, and the thing that I struggle with is because so few people actually do manipulation, a lot of physicians, a lot of patients come to me after being seen by several physicians who didn't know about what I do, and they're just frustrated because they've been sort of pushed along,
Yeah.
and they come to me and they're like, why didn't my last
I
doctor
didn't
know
know
that?
this existed.
Right.
Yeah.
And right now we're at a crux in history where I think it's going to make a big difference in getting manipulative medicine more streamlined, more mainstream, I guess I should say.
Right.
Because the residency programs that used to be separate, the MD and DO residencies used to be separate until this year.
Ah.
So now they're integrating the residency programs, and that means DOs are going to integrate even more with MDs,
Nice.
and MD programs can actually have osteopathic doctors training manipulation in their MD programs.
Very cool.
Yeah,
That is exciting.
it is. Some of the things that I do, even the basics, I could teach anybody to do some of the basics. And if you could at least add that to your arsenal, if you can make a patient's headache go away, it's pretty awesome.
That is pretty awesome.
And I can teach most people to do it. Just take some patience.
Maybe next time.
Yeah,
Okay. All right. Thank you very much.
sure.
All right. We're going to take another break and we'll be right back. And we're back. I want to thank Dr. Cromley for being our guest today, talking about osteopathic manipulative medicine, or OMM, all the things it can do and can't do, and what it is and what it isn't. Just another really useful tool in the healthcare field. So hopefully you learned something about it. If you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Mrs. Pelz at the high school, cpelz@pccsd-k12.net. So think about something you learned about today. If you have more questions for Dr. Cromley, the office number is 419-301-4335. So take this information. Hopefully it's useful for you or someone you love. And until we meet again, I encourage you to make time for health.